When you inhale or breathe in, air enters your lungs and oxygen from that air moves to your blood. At the same time, carbon dioxide, which is a waste gas, moves from your blood to the lungs and is exhaled, breathed out. This process, called gas exchange, is essential to life. Supplemental oxygen therapy helps people with COPD, COVID-19, emphysema, sleep apnea, and other breathing problems get enough oxygen to function and stay well. Low blood oxygen levels, otherwise called hypoxemia, can damage organs and become life-threatening. You may need oxygen therapy for life or temporarily. If your program utilizes oxygen, place oxygen in use signs in visible areas. Never place the tank or machine near an open flame. For example, any matches, lit candles, or a stove that is in use. Keep the oxygen tank at least 6 feet away, and always turn your oxygen off when not in use. If an individual is prescribed oxygen, do not adjust the set flow rate in any way. This can only be adjusted by a licensed personnel, such as an RN or a physician. A pulse oximeter uses a cold light source that shines a light through the fingertip, making the tip area appear to be red. By analyzing the light from the light source that passes through the finger, the device is able to determine the percentage of oxygen in the red blood cells. This test is quick and painless. An oxygen saturation of 95 to 100% is normal for healthy children and adults. There is a significant difference if the person's finger is too cold. So you want to try to warm up the fingertip to get a more accurate reading. Also be aware if the client is wearing fingernail polish, as that could alter the readings as well. Oxygen can be available and delivered in a pressurized portable tank. This can be ideal for people who do not need to use O2 continuously. To use a portable oxygen tank, a flow regulator must be attached to the top of the tank. There are alignment pins located on the tank and regulator to signify where they should be connected to each other. Place a cylinder wrench on the cylinder's on and off valve located at the top of the cylinder. Open the valve by turning it counterclockwise 1 full turn. As the valve opens, the gauge on the regulator will show the amount of pressure in the cylinder. You may hear a quiet hissing if the gauge isn't in the off position. With a 5 to 6 hour lifespan, portable e-oxygen tanks will not last long if used continuously. An oxygen concentrator works by filtering and concentrating oxygen molecules from the air around us to provide patients with 90% to 95% pure oxygen. The compressor of an oxygen concentrator sucks ambient air and adjusts the pressure at which the air is provided. They come in many shapes and sizes, and this is ideal for those who need a continuous supply of oxygen. There is an external on and off switch, as well as a flow regulator where the distribution device is attached. Do not let the concentrator drop in any water. Clean the equipment parts as often as directed by the manufacturer's guidelines or when you feel that dust is building up. Do not use harsh detergents, cloths, or hand soaps to clean. Again, do not adjust any flow setting unless you are a licensed personnel. If there is an emergency with this equipment, there should be a number for the rental service that provided the equipment to your program. If you have trouble breathing, a BiPAP machine can help push air into your lungs. You wear a mask or nasal plugs that are connected to the ventilator. The machine supplies pressurized air into your airways. This is called positive pressure ventilation because the device helps open your lungs with this air pressure. A CPAP machine takes in room air, then filters and pressurizes it before delivering it through a tube and into your mask. This continuous flow of air gently keeps your tongue, uvula, and soft palate from shifting too far into the airway. This stabilizes your breathing and improves your overall sleep quality. You simply turn on the device and put a mask over your nose and/or mouth to receive 2 levels of pressurized air. One pressure level is delivered when you inhale, and the lower pressure is delivered when you exhale. Machines often feature a smart breathe timer that adapts to your respiratory patterns. All settings are preset by a physician. Do not adjust any settings. Humidifiers are designed to deliver the optimal temperature and humidification for BiPAP users to provide additional comfort during therapy. Humidifiers typically have a few settings which increase the warmth of the air. Can also be turned off so air remains at room temperature. Humidification has also been proven to significantly reduce dryness and soreness in the nasal passages. If prescribed humidity, be sure that the reservoir is filled to the fill line with distilled water before use. Nasal cannulas, or face masks, will be chosen by the care provider depending on how much oxygen may be needed at that time. Always wash your cannula or mask with liquid soap and warm water daily. Replace them every 2 to 4 weeks. They are not meant to be used permanently. If you have a cold or are not feeling well, change the nasal prongs when your symptoms are gone. Do not use petroleum-based ointments or lotions in or around your nose, such as Vaseline, Vicks, chapstick, etc. Even though people think that this can be good for dry skin, the oxygen can react violently with those oily substances and they can cause burns. If your client is prescribed oxygen, know when to utilize it during an emergency if needed. Continuously watch your client for increased breathing and heart rate, changes in level of consciousness, restlessness, cyanosis, which means that there is a bluish tinge color on their lips or nail beds, chest pain. Always check oxygen levels if this occurs. A reading of 90% or less is very concerning and may indicate a severe medical problem. Call 911 immediately. If an individual is prescribed oxygen, know when to utilize it during an emergency if needed. Continuously watch for increased breathing and heart rate, changes in level of consciousness, restlessness, cyanosis with bluish color on the lips or someone's nail beds, and chest pain. Always check oxygen levels if this occurs. A reading of 90% or less is very concerning and may indicate a severe medical problem. Call 911 immediately.